So I'm taking Utrogestan, which is a pharmaceutical and bioidentical form of progesterone. So it's little progesterone capsules there. I've been on it a month and just over a month and a half, and I feel really good on the Utrogestan. So before Utrogestan, I was on compounded bioidentical progesterone. So compounded is not made in a pharmaceutical lab. It's made in a compounding pharmacy. So it's not governed by strict regulations, and the product could be what it says, or it might not be what it says. It might be too strong, too weak. They might have different fillers, additives. The problem is it's not regulated, so you don't know as a consumer for sure that what you're getting is what it says on the label. And that is the problem with compounding pharmacies and their products. I'm not saying that all of them are bad. I'm not saying that if you feel great on a compounded product, you should stop it. I don't know. What I'm saying is maybe you can test your levels and see. And if you feel that it's working for you, then that's great. It's working for you. However, I do ask you to consider maybe looking at pharmaceutical options over compounded options for HRT. HRT stands for hormone replacement therapy. Look at the pharmaceutical options because they do exist. And so in my mind, I'd rather know that what I'm paying for and what I'm getting is what it says on the label. So it comes from a big lab. They've done studies. It's rigorously tested. The dosages are all uniform, all the same. That is what it's supposed to be. And it should work like it says. Whereas with compounding, and I've experienced this, it doesn't work the same as the pharmaceutical stuff. Now, in terms of the progesterone, I don't know whether the compounded stuff was working or not. It felt like it was. But on the Utrogestan, I'm on 100 milligram tablet at night. So I just take one tablet at night, so once a day. And I really feel that it helps me sleep. It helps me to fall asleep really quickly. And I can actually feel the onset of that sleepiness after I take the Utrogestan. It's not hectic like a sleeping tablet, but I do feel a little bit more drowsy. And so I would caution, don't take it in the morning. But I mean, maybe if you're not susceptible to that, it's fine. Negative side effects of progesterone that I've read about are that it could cause grumpiness and moodiness, but in me it hasn't. And I think that the negative side effects are usually to do with the progestins, which are synthetic forms of progesterone, meaning they are not bioidentical. Now, bioidentical means that the molecule of that hormone looks and acts exactly like the ones our bodies produce. Now, obviously, anything pharmaceutical or compounded is still not what our bodies produce. It's always made in a lab, but the molecule is structurally the same as what our bodies produce. So to me, think of a key fitting into a lock. Bioidentical, that key looks exactly like the key that your body produces, and the lock is the hormone receptor. So that key fits perfectly into the lock. With progestins, which are synthetic, the key might be slightly differently cut, but it will still open that lock. So it'll still work on the receptor, but maybe in a slightly different way, or maybe some of the effects in your body are slightly different. So now with progestins, what Menopause Taylor, who is a retired OBGYN, she's got a YouTube channel, she has said that the progestins, the synthetic progesterones, actually do a better job of thinning the lining of your uterus and protecting it from uterine cancer. Which brings me to the main reason to take progesterone. It's to keep the lining of your uterus thin. That is the function of progesterone. It holds the overgrowth of your uterine lining. Estrogen fuels the growth of your uterine lining. And so if you have a uterus, you need progesterone in some form. Now, you don't have to take Utrogestan. You can do other methods. You can either be on like a birth control pill, which has got estrogen and progestin in it, so it perfectly balances that. That's why the period is so light when you're on the birth control pill, because your uterine lining hasn't had a chance to grow too thick. You could put a Mirena, which is an IUD that contains progesterone. Well, it's a progestin, and now that IUD, it delivers local progestin just to your uterus. It doesn't travel throughout your whole body. You could use progesterone cream, but again, those generally tend to come from compounding labs, as the one I used previously did. And I've heard and read that progesterone doesn't actually absorb very well through the skin. I don't know if that's true or not, but I think why even take a chance, just be safe. You can get Utrogestan from a doctor, from your gynae, and just take that. So it's working really well for me. In general, the hormone progesterone, it is a pregnancy hormone, but for us who are in perimenopause and menopause, the benefits of taking it would be obviously to keep your uterine lining thin, to promote better sleep. And I will say again, I sleep really nicely on it. Not that I was having any major issues sleeping, but I do find I fall asleep really easily with the Utrogestan. I'm not experiencing any negative side effects, no breast pain, no breast tenderness, no weight gain. I mean, the weight gain only comes when I overeat, which we all do from time to time, you know, snacky and peckish. I feel generally good and well. They say that progesterone is a calming hormone. So if you're prone to anxiety, it might be worth investigating, trying progesterone, see if it helps calm you down. They say it's a muscle relaxant. One of the things I have heard and experienced, but that was when I was on the progesterone cream, is that potentially it can cause constipation, but I haven't experienced that at all with the Utrogestan. So there's been no trouble there. And overall, I would say if you're unsure, give it a try. It's a natural hormone. So if you're in perimenopause and menopause, obviously, if you're not, you don't need progesterone or any of the stuff that I'm talking about. So this is for women in their 40s and over. But generally, you would take it as part of your hormone replacement therapy regimen, along with estrogen. Now, estrogen is the main hormone that you need to focus on and think about replacing if you're going to go onto HRT, hormone replacement therapy, because it's the estrogen dropping off that causes most of the perimenopausal and menopausal symptoms. But today, I just wanted to cover briefly how I'm feeling on Utrogestan. I'm very happy with it. It is balancing out the estrogel that I'm taking, the Femigel. And so I haven't had a period in a month and a half while I'm being on both of them together. And so it's working to prevent the overgrowth of my uterine lining, because if my uterine lining were growing and growing and growing, at some point it would break off and shed and I would either spot or have a period. So I know that it's working for that as well. And in general, who doesn't want a good night's sleep? So I would say even if you don't have a uterus, but you are on a form of estrogen replacement, some kind of therapy, a patch, whether it's the gel, a tablet, and you want to try Utrogestan, you can still take it. You can try it. You don't have to have a uterus to have it, but you need it if you have a uterus. I hope you found this video helpful. Thank you for watching. I'll see you in my next video. And as always, I will link my whole perimenopausal, menopausal playlist down below. I've got lots of good videos. As you can see, I've been researching this and talking about perimenopause and hormones for like 4 years now, 3 years. So thank you for watching. See you in the next one. Bye, ladies.